Hi, this video will walk you through on how to look at marketplace health insurance plans and the prices on HealthCare.gov website. You don't need to create an account to browse the different plans available, and you don't need to apply it. You can simply browse it without any of these two options, which is not creating an account and without applying. By the end of this video, you are gonna gain knowledge on how to check what plans are available in your area and how to see your real costs with savings, and how to compare the different plans side by side, and how to tell if your doctor is in network. So let's get started. So the first step in here is you need to go to the website of HealthCare.gov. Depending on whichever browser you're using, you could use Google Chrome, Edge, or if you're on your Mac, you could simply use the Safari. So I'm gonna try to go into HealthCare.gov here. So I'm just typing that in and just pressing enter, and you should see a website similar to below. Right now there is a small pop-up which is coming up reminding that open enrollment is starting soon and to create an account. You don't need to do that when you're browsing a plan, but if you're trying to apply, we would definitely suggest you to create an account. So I'm going to exit out from there. So to the right side you see some different options available, which is to get marketplace basics, log in to make any changes, and browse plans and costs. So we're going to click on the option of browse plans and costs. As you can see right now, we do have the 2026 plans preview available, which is great. The website was not reflecting this until October 28th. So as of this morning, everything seems to be available, so you can quickly preview the 2026 plans. So right here under the zip code, you need to enter the area where you are staying and the zip code associated to that area. For example, we are in 99503 Anchorage, Alaska. So I'm going to type in 99503 here. Just keep a watch. Just typing in 99503 would not produce any results for you. You need to click on this option available right here, which in this case it says Anchorage County, Alaska with 99503. So I'm going to click on that and going to hit continue. So as you can see, this is like a quick preview. And the zip code has already been entered. The next thing it's asking us is to tell us about you and your household. So there are different ways you could check the plans on Marketplace. Choice one is to go based on your true household, the actual household income, to get an understanding of the different discounts you might be eligible for and the tax credits you might qualify for. So that's going to be the actual true cost you might be paying out of the pocket, which is what we suggest everyone to look at. An alternate option to this, instead of entering all your household information, income information, etc., is to skip this step fully and just look at the full out-of-pocket cost. So this is also called like a sticker price, and it is based on a sample person who is 35 years old with no savings applied. This is usually higher than what you will actually pay, because I wanted to really look at a more accurate option entering my info, because most of the people qualify for savings that can drop a plan from thousands of dollars a month down to just a few dollars. So that's the option we're gonna go with. So let's do that. So right here, we're gonna enter some household questions. Now we're gonna answer a few questions about who is in the household. This matters because the marketplace looks at income and household size together. So click on start right here, which is available in green. And the first question you see here is, are you enrolled in a 2025 marketplace health plan? So if you are new to the healthcare marketplace, you can simply skip this, but if you have already applied in 2025, it would be ideal to enter your plan ID and click continue. So in this case, I am new to the marketplace enrollment this year, so I'm going to skip this step completely. And the question we have here is, what is your household? Your household includes you, your spouse if you're married, and everyone you will claim as a dependent on your tax return. Include them all, even if they don't need coverage. So for an example, I'm a family of 3, myself, my spouse, and a kid. So I'm going to choose use you and other people option right here. I'm going to click on continue. The next question I have is, are you married? Because we're a family of 3, I'm married, I have a spouse, and we are not divorced or legally separated, unmarried, or living together or widowed, I'm going to choose yes for this one. And I'm going to click the option of continue. The next question you have here is, will you claim any dependents on your federal tax return? So think about your family and see, do you have any dependents you're going to claim? In my case, since we're a family of 3, we do have a kid who I'm going to claim as a dependent in my 2026 tax return. Even though they don't need coverage, I'm still going to include it. That's just what HealthCare.gov is asking us to do. So don't count yourself or your spouse as a dependent. So in this case, since I have a kid who is just 1, I'm going to enter 1 here, and I'm going to click on continue. Then HealthCare.gov is asking some information about you. So this step is pretty much asking some basic information such as age, sex, and a few yes or no checkboxes. Quick review here. The few options available are eligible for healthcare through a job, Medicare, Medicaid, or CHIP. So if you have like an employer-sponsored health insurance, you need to choose that option. And this is a key because if your employer is sponsoring a plan, but if the premiums are too high and not affordable, which is why you're coming to Marketplace to enroll in a health insurance, there is a tool. It's the employer tool is what it is called. You need to submit that in Marketplace, which is some common thing everyone miss. Apart from that, the other checkboxes you have here is legal parent or guardian of a child under 19, and if you're pregnant, and of course there's a disclaimer there, don't include a baby as a dependent until the baby is born. Just make sure you're not including them as a dependent if they're not born yet. And it also asks about if you're a tobacco user. So let's get started with the first one. So I'm the first person in here, and it's asking for my information, and all of this is for demonstration purposes only. So I'm just gonna choose an age of 38 with the sex of male, since I have a kid who I'm gonna claim as a dependent, and I'm gonna mark the legal parent or guardian of a child under 19 right here. And none of the other options are needed for me. They do not apply, so I'm just gonna click continue. The next step is it's gonna ask this information for the whole household family. So since I chose like we're a household of 3, it's gonna ask information about me, my spouse, and also my kid. So the next information in here is the spouse. So I'm gonna enter her age as 34, for example, and sex of a female, and she's a legal parent of a child under 19. And she's not pregnant, she's not a tobacco user, and so I'm gonna click continue. And this is the dependent, this is my kid's information. So for example purposes, I'm gonna enter the kid's age as 8, female, and none of the options would apply for her. So I'm gonna click continue. Now you are directed to a screen, which pretty much is a summary of what you entered for the household. That is my information, which is my age, legal sex, and this checkbox options which were available. Same thing applies to my spouse and the dependent. If everything looks right, you're gonna go ahead and click on confirm. If something looks incorrect, you can click on this edit option and make changes. This is important because, like we were saying earlier, it's important to choose all the options accurate to know the accurate out-of-pocket costs you need to pay to be eligible for the health insurance, which is the premium. So since everything is looking right here, let me confirm what I entered and just go ahead to the next step here. This is key, and this is one of the most important screens you need to be looking at, because you're gonna think about what your household income is gonna be in 2026. And again, this is a household income. So if you are not the only person working, if your spouse is working, you need to include the household income, which is yours and your wife income together. There are some quick tips available where you could simply click on the link right here, which will tell you on how to estimate your income. Just go through these just to make sure you have a rough idea on how much the income you're looking for. Another option is if you have your W-2s or if you have your pay stubs, if you have a rough idea on how much you're making, I would just calculate that as an yearly income. I'm not anticipating much changes in our yearly income next year, and I'm the only person working in the household. So I would just go with my income at this point. And always it's suggested to slightly overestimate your income, because at the end of the year, or like let's say you have a drastic change during the year that you have a significant salary increase, you need to go ahead and update that in your healthcare.gov so that your premiums get updated, because we don't want to not disclose that information to the government, and during the tax returns you might be ending up paying a lot to the government in the form of taxes. So it's always suggested to slightly overestimate it. So my 2025 income is roughly looking like around 78,000. So to be on a safer side, and I put 85,000 as my estimated 2026 income right here. So you can click on continue once you enter the information. And as you can see, the screen goes over the estimated savings. It's telling my age, spouse is independent, and it is telling I'm eligible for some premium tax credits. And right here, there is a number of $1,976 per month is what I'm saving. So we talked about the sticker price at the beginning of the session. So a plan may be costing like $2,000 as a premium per month, but based on this one, it's telling I would be eligible for a tax credit of $1,976, which tells me that I only would be paying like $24 to be eligible to take a plan. So this is very key, which is why we ask you to enter the actual information so you get to see how much premium tax credits you are available for, because sticker price is always going to be a high number. So since I have a rough idea on what my tax credits are, let's go ahead to the next step, which is to view the plans. A pop-up would immediately appear. So this is pretty much on how to filter, getting some key definitions, and also how to compare plans. We're gonna go over how to apply some filters and compare the plans in the next few steps. So I'm gonna exit out of this one right here. And now you're looking at the real plans, which are available based on the geographical location. In this case, I entered 99503, and I also entered my true family income as well as the household size. So this would give me a rough idea on how much I need to pay out of pocket to be eligible for the plan. A few things you notice on each plan. For example, you see Primera Blue Cross here. It's a preferred bronze 5800. I have a bronze 6350 here. You can keep scrolling down. There's a bunch of plans. Usually it's bronze, silver, and gold are the common ones. We don't have platinum in Alaska. So just scrolling down, there are different options available. And other things you need to notice on each of the plan, which are key in some decision factors, is the monthly cost after savings. So right now it's telling me that I need to just pay $3 per month, which includes the tax credits I'm getting back, which is that 1,976. So if I did not have, or if I was not eligible for any of the tax credits, I would end up paying $1,874.41 per month. Because I was eligible for tax credits, I'm ending up only paying like $3. I always look at the deductible account, like how much it is. So in this case, it is saying my deductible is $11,600 per year, and my out-of-pocket maximum per year is $16,000. Another key areas I would look at is how much each of my visit is gonna cost. So for a primary care visit, it's currently telling me that 35% co-insurance after deductible, specialist care is 35 co-insurance, and all this. So each plan has a different. For example, you saw like 11,600 here. You're going up to like 12,700 as deductible here, and different ones have different deductible amounts. And as you can see, the primary care changes. Previously, you saw a co-insurance amount after deductible. Here is you're just paying a flat fee of $45, which they call it as a copay. So let's go in deeper. Like, for example, you do have a list of providers you usually visit. For example, I'm staying close to Anchorage Neighborhood Health Center, and my primary care physician is at ANHC. So if you wanted to see if the plan covers your visit when you visit a particular provider, in this case, I'm looking for Anchorage Neighborhood Health Center, that information is handy and you could simply enter it here. So for example, it says there are two options. So if you're using any drugs which you need most of the time, and let's say I want to always see Anchorage Neighborhood Health Center, so I'm gonna add that provider right here. So click on this option called Add Doctors and Facilities. So you can type the doctor's name to look up here. So in this case, I'm trying to look at Anchorage Neighborhood Health Center. It's a general practice, it's FQHC, so I'm gonna hit search, and you could see I don't use dental services, but I definitely come here for family medicine visits and stuff. So I'm gonna click on add, and it's gonna give a small pop-up just to say some plans would not cover all facility locations, which is right because not all of the providers are in network with all of the plans. So in this case, I'm gonna say I understand that. So I'm gonna click on yes right here and just click continue. So now, since I already had entered ANHC, if there is any other facilities you're visiting or a specialist, double check that and just keep adding the providers as you need. Now, since I'm only selecting ANHC, I'm gonna finish and check on coverage. Another thing, if there is any kind of prescriptions you wanted to make sure they're always covered in the plan, you're gonna click on add prescription drugs right here, and you can find the different drugs you always need. So in this case, I really don't have any prescribed drugs I currently take, so I'm skipping that step. But right now, here is how it looks like, right? For right now, when it says like a checkbox that tells me this plan is eligible when I go to ANHC, and ANHC is an in-network provider for this particular plan. Another thing we wanted to always know is what are the different plan types you're looking for. So right now you're looking at health plans. Let's say you're only looking for dental plans. You can simply click on this drop-down menu and switch the concept to dental plans right here. So it'll tell you all the different dental plans which are available in your locality and the different premiums, etc. But my primary focus here is health plans, so I'm gonna just do that. And always, like, if you wanted to go in depth in a plan, you can simply click on go to plan details, and it's going to provide you a granular information on what your costs are. They're like cost for medical care. You can simply expand that. It's going to give you in detail. A primary doctor care visit is 35% co-insurance, and specialist is 35 as well. You can go in about the x-rays, laboratory, hearing aids, and all this good stuff right here. There's also a section for prescription drug coverage it goes over. You can hover on it and just double check as you need. Another thing we wanted to cover on this video is to compare the different plans. So as you can see, by default, this is set to sort by the lowest premium first. You could also change that to a lowest deductible if you don't want it to be paying a lot out of pocket. For example, the lowest deductible plan I have here is $4,000. I think it's like $3,000 right here. So you can simply sort it that way, and you can look at plans deeper. One good thing HealthCare.gov provides is to compare the different plans. Let's say you went through the individual plans. For example, I'm a person who don't want to put a lot of out-of-pocket costs. So when I'm going to a primary care physician, I just wanted to pay like a flat fee, like a $30 copay or a $45 copay. And when I'm going to a specialist for more broader checkups, I don't want to pay beyond like $80 or something. If that's something you're looking for, then I would definitely concentrate looking on this section. I don't want to be in a spot where I'm taking a plan and also later I'm ending up paying a lot out of pocket. So depending on like whichever situation you prefer, whether you wanted to pay low premiums per month to be eligible for a plan and just incur more out-of-pocket costs during a visit, you could choose that section. If you're a person who would like to pay more premiums ahead and reduce the cost of the visit, you can go the other way as well. So for an example, I see like this 3,000 plan looks like something which I could try to afford, and it's only telling me that I'm only needing to pay like $25 as a primary care during a primary care visit, and a specialist is a $50. I definitely feel that is something super helpful for me. So I want to compare this with the other plans available. So you could simply click on this compare checkbox right here. There are also other options available. I wanted to see how it would look when the premium is low. In this case, it's saying $27, but there is a 40% co-insurance. So let me see like how it would work out. And let's select one more plan. Let's see which is reasonable. So let me click on compare. So like you can see, it only lets you compare up to 3 plans at once. So right now I have chosen 3 plans. One is through Moda, which is a gold plan. And I have chosen one more, which is also a Moda plan. Maybe for easier demonstration purposes, like it does not let you go beyond 3. I'm gonna choose a Blue Cross plan right here, and there is one more which is also a Moda plan. So click on this compare option on the top. So the moment you select more than one plans for compare, this option is going to show up. So when you click on this, all of this information would be a side-by-side comparison. So the first one, as you can see, is a bronze plan where the monthly premium is low, which is $27.38. And I selected the gold plan from Moda, which is $302, and the Primera's gold plan is $341. As you can see, the sticker price, which we talked about earlier, is this high number of like $2,000 and $1,700, but because I was eligible for the tax credits, it's taking off that price and giving me what I should pay out of pocket to be eligible to take the plan. And of course, deductible does apply to some visits. Some preventative care might not have a deductibles, but these are some out-of-pocket costs I need to pay before the insurance starts paying. I definitely don't want it to be at a spot to pay this much amount out of pocket, like $5,500. I would definitely lean towards taking a lower number right here. Here at the out-of-pocket maximum, that is the maximum amount you should ever pay, you would ever need to pay before the insurance covers in full. This is the different plan metal levels, like we're talking about, like bronze, silver, gold are the common ones. And the plan types of PPO, you have the plan ID. This is what is crucial. Like if you could remember earlier in the video when it's asked for like, hey, did you have a 2025 plan? And it asks for a plan ID. This is what it is looking for. Once you're browsing the plans, just make a note of the name of the plan you decide to take, because this would be crucial, because when you're trying to apply, if you have that handy, it makes the work easier rather than juggling and again trying to figure out which plan it was. And looks like the provider which I usually see is in network with all of these plans, which is good to know. The star ratings is really not something I really care about, but there is more of, if you wanted to look into that, you can definitely expand and look at the different ratings in there and the concerns etc. You do have like different plan documents. You can click on them, go through them if you need to. The main thing I'm gonna look at is my cost for medical care. So it's telling my in-network is $2,000. Let's say if I'm going to an out-of-network provider. In this case, ANHC is in-network, but let's say I went to a provider named John Doe who is out-of-network. Then my out-of-pocket costs, of course, are going to be high. It's always ideal to see an in-network provider whenever possible, so that your insurance covers most of the amount and you're only paying a minimal amount. The moment you're going to an out-of-network provider, you end up paying a lot of costs. So the other thing we are looking here is for the specialist visits, where I could definitely see a 40% co-insurance after deductible. That's high for me, but this one is just like a $60 per visit, which is good. And if I go to out of network, of course, you could see the price changes going all the way from $60 to 50% co-insurance. Talks about the preventative care. You can look at it. And then the same thing with x-rays, laboratories, and everything. So explore all the different areas, and once you were ready, you feel like, okay, I'm ready for a plan, I know which one I'm going for. In this case, I feel like the best option that would work for me might be Moda, so I'm gonna make a note of the plan. It's called Moda Select Alaska Standard Gold, and I'm gonna take a note of the plan ID. So when you're trying to apply, this is all you would need. And hopefully this video is helpful for you on how to browse the different plans available and how to figure out the different costs which would be associated with it. And we did go over how to compare the plans. Thank you so much. We appreciate you taking time to go over this.